I will confirm that we let go Susan Monarez yesterday. I'm not going to talk about it. But, the CDC is an agency that is very troubled for a very long time. So there's a lot of trouble at CDC, and it's going to require getting rid of some people over the long term in order for us to change the institutional culture and bring back pride and self-esteem.
Thank you for being here. How can you ensure that the CDC can continue to operate effectively in light of these recent resignations?
Oh, if I could just say one thing, I know he'll be happy to answer that in a second. If we could stay on topic first. Thank you for not wasting any time getting off topic. Let's. I know we're going to come back to you, but.
Well, I think the big beautiful bill, the money. That's why we want to get money out the door as quickly as possible. This is an unprecedented fast pace, and the reason that we're addressing this with such rapidity, which puts a huge burden on my agency and the federal government to make these decisions, is because we understand the dire need that people in rural areas are now suffering, and we want to get them that money as quickly as we can.
Also, in the legislation that we signed in the regular session, there was about $300 million that went to address healthcare needs like that in rural regions in the state of Texas.
Secretary, I have a question for you. So you talked about telehealth. There's a few things working in rural communities that, as we know, many areas in the country are designated behavioral health workforce shortage areas. And so while we're saying telehealth is a solution, if you don't have the staffing across the state to address the needs of families, where do we go from there? How are we going to address the staffing issues to make sure that families in crisis can manage this kind of resources telehealth? And is there a plan in place to sustain a 90-day crisis lifeline so that people can have a direct source of support? I'm sure I'm looking at that looking at this, but it's important to me to know that that resource follows all the way through to a person in need.
Sure. So we both tried that. So for one, you're mentioning a couple of things. One is the availability of telehealth. We realize that's possible in some ways, not possible in other ways. We've got to find ways to expand that. Staffing is another crisis point issue that we're working to address, whether it be on mental health related issues or non-mental health based issues. But it's, through the telehealth, that's one way in which we can actually expand access to staffing without them being there in person, but through the telehealth approach.
Two more questions.
Right. Secretary Kennedy, that's Karen Foley, CBS News. Thanks for being with us today. My question is, in speaking of rural Texas, we know places like Uvalde have experienced one of the worst mass shootings in history. The CDC has previously been responsible for studying gun violence. A lot of those programs have been cut now. Would you still consider gun violence a public health crisis? And who's going to be...
I certainly consider mass shootings a health crisis, and we are doing for the first time real studies to find out what the etiology of that is. And we're looking for the first time at psychiatric drugs. These kind of mass shooting, people have had guns in this country forever. When I was a kid, we had shooting clubs at our school. Kids, my classmates, and other people would bring a .22 rifle with their guns to school and park it in the parking lot. Nobody was shooting. So there's never been a time in America, in the history of humanity, and people walked into a crowd, into a church or a movie theater or a school or a crowd of strangers and just started randomly shooting. It's happening in our country. It's not happening around the world. And there are many other countries that have comparable levels of guns that we have in this country. We had comparable levels in the 40s, 50s, and 60s, and people weren't doing that. Something changed, and it dramatically changed human behavior. And one of the culprits we need to examine is whether the fact that we are the most over-medicated nation in the world, and that a lot of those are psychiatric drugs that have black box warnings on them that warn of suicidal and homicidal ideation. So we are doing those studies right now for the first time, and we will have an answer.
Last question. About the CDC, about the...
Hold a second. He opened with that. He gets to go back to it.
Thank you, Governor. My question was, in light of the recent resignations of the CDC, how are you ensuring that that agency is able to do its job effectively?
I would say this, that first of all, I will confirm that we let go of Susan Monarez yesterday. I'm not going to talk about personnel issues, but, the CDC is an agency that is very troubled for a very long time, and anybody who lived through the COVID pandemic and saw all of these bizarre recommendations that were not science-based, all the misinformation, understands that the CDC has on its website today that among the top 10 medical innovations, greatest medical accomplishments in history was abortion. This is one of the greatest medical accomplishments because it keeps small families. Go to the website, look at it. Fluoridation, giving kids a toxin, and vaccines. So there's a lot of trouble at CDC, and it's going to require getting rid of some people over the long term in order for us to change the institutional culture and bring back pride and self-esteem and make that agency the stellar agency that it's always been. I'm very confident in the political staff that we have down there now that they're going to be able to accomplish that and ensure the competent functionality of that agency. Add to that, one of President Trump's primary passions are the rural areas of this country. These are the areas that he won overwhelmingly because he was communicating his understandings of their importance and their needs. And you just heard this very erudite description of how rural areas, particularly in Texas, provide the food, the fiber, the energy that we use throughout our country. President Trump also understands that there's a cultural importance to us preserving the rural areas of the country. This is the source of our values, our virtues, our character as a people who came from the small towns, from the rural areas. President Thomas Jefferson said that American democracy is rooted in the tens of thousands of independent freeholders who own the land, and without them, who have a stake in our economy, a stake in our system of government, a stake in our culture. And if we lose rural America, which we're in danger of losing right now, we'll lose part of our capacity to preserve and understand and appreciate the American soul and the American experience. Rural America is in crisis, and the rural hospitals are absolutely critical for them surviving these crises. These institutions are not just medical providers. In most cases, they're the single largest employer in those areas. They have the highest paying jobs. And when they lose them, as we talked about before, it's not just the hospital that closes, it's the pharmacy that closes, it's the stores that close, and the community collapses. So we have to, and President Trump understands this, preserve these rural hospitals, and they were closing at an epidemic rate. And that's why he put in the big, beautiful bill, the Rural Transformation Program. And I'll talk just a little bit about what that will do. Right now, we send about 7%, 6 to 7% of Medicaid dollars to rural hospitals. And that's about a total of $19 billion a year. So they're already getting shortcut.